Hello, welcome to Ask the OT. I'm Dr. Frederick Covington, and I'm an occupational therapist. Today, we'll be discussing an aspect of sensory integration dysfunction. We'll be talking about sensory sensitivity, also known as hypersensitive. Now, the medical definition of sensory sensitivity is that it refers to a pattern of sensory processing that is characterized by low sensory thresholds and a passive self-regulation strategy. When people have a sensory sensitivity pattern of sensory processing, they detect more input than others. It's hypothesized that they have low thresholds that enable them to have a high rate of noticing what is going on around them. These children use passive strategies in that they allow things to happen and comment rather than removing themselves. People with disabilities such as autism, Asperger's syndrome, and ADHD are significantly more likely to engage in a high amount of sensory sensitivity patterns. When a person has sensory sensitivity patterns, interventions are directed at providing more structured input so that the person does not become overwhelmed in everyday life. Now, let's clarify what I just said. We're going to break it down. Children who have sensory sensitivity patterns notice much more than other people or students around them. The normal things that we notice can at times seem overwhelming to them. The sensory sensitivity appears to amplify or boost all sensations. Sounds can be louder, smells can be stronger, lights can be brighter, touch can be more intense, and even taste can be stronger. Their reaction to this extra input makes them seem hyperactive. Now here's an example. Michael is easily distracted in class. He always seems to be occupied with what's going on around him. He often complains about what's going on in the classroom, saying things like, "It's too loud in here," or "the wind is blowing through the windows too loudly," or "it's too cold." He seems to notice everything in the classroom, every noise, every movement, every smell. And this makes him seem like somewhat of a busybody or a complainer. Now on the playground, when all the children are outside running and playing, he joins right in. However, at this point, his sensory sensitivity again works against him. When frolicking around with his classmates, he interprets some of their physical contact with him as pushes or being hit or punched. However, this is not the case. It's his sensory sensitivity or hypersensitivity that is causing him to interpret the physical contact as harsh. This in turn makes Michael seem aggressive in the eyes of both his classmates and his teachers, because when he feels that he's been hit or struck, he retaliates, which sometimes leads to physical altercation or even fights. Now there's multiple symptoms that may indicate a problem. One may notice any little or light touch to the skin, whether it's a person touching them or any type of object, whether it be smooth or rough material. A person may cover their ears with certain sounds or has extreme fear when unexpected noises are occurring. And sometimes they may leave or withdraw from the situation. Sometimes they need to smell or touch food before eating it. At other times, one may complain about the way clothes feel, especially if there's a tag or a seam. Another indication of a problem is that a person could be limited on their food choices and may only tolerate food with particular color or a particular texture. Now, as always, if you have any questions or comments, please feel free to email me or leave your comments here. And we'll be seeing you next time.